Dr. Shrinath Kshirsagar. I am a consultant hematologist and hemato-oncologist from Global Hospital in Mumbai. And as we all know, September is a blood cancer awareness month. So I'll be sharing my thoughts about blood cancer with you. And I hope all of you and your loved ones are doing well and are safe in current pandemic time. And generally, blood cancer, when you hear the word blood cancer, it brings the sadness. But nowadays, with the advance of technology and science, blood cancer outcomes have improved significantly. And so we can definitely cure the blood cancer with available methodologies. Many of the blood cancers can be cured with availability of the newer medications and techniques. So to begin with, we'll discuss about the symptoms of the blood cancer. And blood cancer symptoms can vary from person to person. Person can have fatigue, weakness, fever, and also he can have a bleeding spots, bleeding through his nose, bleeding through his gums, or bleeding through his motions. Or women may face a menorrhagia, and many of the patients will feel some nodes in there or lumps in their neck or axilla sometimes. So basically, for diagnosis of blood cancer, we'll have to do the CBC. CBC means complete blood count, and that will tell us about your problem in the hemoglobin, problem in the WBC, and problem in the platelet. If there are some problems, or if your hemoglobin is very high, or if your hemoglobin is very low, similarly, if your WBCs are very high or very low, as well as your platelets are extremely on higher side or extremely on a lower side, then it's better that you show it to your general practitioner and get it evaluated. From there, he can send it to you, concerned doctor, also known as a hematologist, for further care. And there are multiple types of the blood cancer, and there are generally three types which are most important. First is leukemia, lymphoma, and myeloma. Leukemia is a cancer of your blood cells or immunity cells, and in a leukemia there will be proliferation of the cancer cells. So there are two major types of leukemia. One is a chronic and other is a acute leukemias, and their symptoms varies from each other. Acute leukemias are very rapidly progressing leukemias, while the chronic leukemias grow steadily. And lymphomas are cancer of your lymph nodes. In the patients with a lymphoma, they may feel enlargements of the glands in the neck or their axilla or in the groin. And patients with a lymphoma will have a fever, weight loss, and the loss of appetite. So, like leukemia, again, there are different types of lymphoma. Treatments are different from each and every lymphoma. And myeloma is a disorder of the plasma cells. In myeloma, it affects your blood, it affects the bone marrow, as well as it can affect the kidney. And coming to the treatment, blood cancer treatment has improved significantly in last few years. Treatment varies from simple oral tablets to autologous or allogenic or autologous bone marrow transplants. And in some of the cancer, we can definitely control by just giving the oral tablets. And it's always better that if we diagnose any cancer early, so treatment outcomes are much better. So that's why we have to be little vigilant about these symptoms. Thank you very much.